Hello, I'm Dr. Paul Vanek from Mentor Plastic Surgery. I'm a board-certified plastic surgeon and board-certified general surgeon. I've been in practice since 1996 in the Cleveland area. I'm going to talk today about plasma charging your open neck and facelifts. I've been doing these since early on. I'm an early adopter with Renuvion. And what I'd like to share with you today are some facial rejuvenation standards that I've adopted in my practice, as we all may have, doing more than one thing at one time, doing face, brow, eyelids, fat transfers, rhinoplasties with open technique using Renuvion. I do closed necks, I do open necks, and I've decided to put this talk together to talk about the individual techniques for doing open necks, as I've done both types, but just showing you in the left upper quadrant, a 62-year-old, in the right upper quadrant, a 67-year-old. That's blocked out by my image, but we'll get there later. Left lower quadrant is a 61-year-old, and in the right lower quadrant with a very lax neck is a 74-year-old. Again, 1 year follow-up at age 75. So we're going to get underway. So I've used the first generation, and now we have second generation Renuvion on patients that have had open necks with coarse platysmoplasty. This is an intraoperative photograph of the patient using the technique of making the skin flap. I've already tightened the SMAS. I pre-surgically harvest the fat and put the fat in. In this case, the patient's had an endoscopic brow lift, and I did a dorsal onlay rhinoplasty because she had some heterotopic bone. But so you can see that her nose had surgery. But this is the technique using 80% energy, and I've turned the energy down over time, but 80% at 2.5 liters with 6 passes. And as you see, once I applicate the SMAS, or excuse me, once I do a SMAS elevation, the skin treatment in this single pass is pretty typical for doing 6 passes. There are other users that have taken this energy down to 60%, 1.5 liters. Because we have the dual port Renuvions, I do have a different notion about versus the single port, but I'm very happy with some of the results that people have. This is an 11-month follow-up. I'm sorry about the facial animation in the picture, but if you focus on her neck, what you're seeing is you're having tissue contraction, collagen contraction. You're experiencing what I see in real time as a surgeon who's done cases with Vaser in the neck and now Renuvion in the neck, is collagen fiber shrinkage. When we look at the redraped SMAS, there's not the same recession that we often see as surgeons with a SMAS lift, with having neck jowling redraping and having drapey skin. The Renuvion, in my opinion, has given me a substantial improvement over my historical facelifts. And for that regard, I'd like to just advocate that, seeing that in the operating room, seeing the tissue coagulation and the tissue tension instead of laxity, I'm very happy with what I'm seeing as a rejuvenated long-term result. Patients who may have had facelifts before would often complain and say, look, I've had a surgery elsewhere. Everything went fine. I liked the surgeon, but my tissues, they either said it was surgical technique, and it probably was. It was probably because we weren't adding energy with helium plasma to our current facelift armamentarium. By making thin flaps, I think I have some issues with having to be very careful with not overcoagulating, especially at the inflection, at the neck, at the cervical mental angle. And in that regard, I have been very fortunate not to have some of the early problems that other users have experienced and talked about on Doc Matters. But when we look at a person who's had a change in their neck physiology. So when we have a patient that's a fresh post-op, this is her pre-surgical condition, and on her evaluation immediately, I'm seeing a different tone in the skin. And on a face and neck lift, a 50-year-old, that's 60%, 1.5 liters with 6 passes. We did a neck lift with coarse platysmoplasty, and this is her at 2 weeks post-op, took some moles off, but you can see there's very good healing. There's very nice tight tissue contraction. I'm getting collagen contraction in the operating room. And when we look at these patients in real time versus their historical, again, she has no control, nor do I, over what her historical facelift would be. But when we look at her outcomes and how they look in a short period of time, we have some substantial collagen contraction of tissue, collagen fiber shrinkage. And in my opinion, I'm seeing results that are different from 23 previous years of facial surgery, 23 previous years of neck redraping after course of platysmoplasty. And I think that the reduction in tissue tension manifests early. The patient has a result that I think is different than what you and I may have seen in previous years of service. And we have long-term results. These necks hold up. These neck skin changes are very substantial. Even though I'm showing early results, what you see is the secret to a great late result is a great early result. And I want to say that by having that kind of change that we see with Renuvion, we're able to see with different age groups on people who are looking for manifestation of facial rejuvenation. The patient who doesn't like how their facial draping is, they don't like that they have skin that wasn't like a bygone era, and the sharpness you see of the neck, the cervical mental angle, the sharpness that you see around the jawline is different than what I've been used to seeing in previous performance in my own practice. I'll use only my own performance and not talk about others. But even at a short time, at 1 week post-op, the person manifests a very substantial improvement in what is then months later and up to now, years later, in improvements in tissue laxity, tissue coagulation results in very good skin tone later. I do some things that are different than years ago, but I also have incorporated this sort of technique with a 63-year-old that is different than ever. Going on to a 69-year-old who has a lot of weight loss, flips up and down, and this is her using 70% energy, 2.5 liters, 6 passes. I've combined neck lift with corset, Renuvion neck and face subcutaneously, autologous fat grafting at the time of facelift, and an endo brow. And here she is right after things are settled down a bit. And you can see her tone of her skin. She's delighted. She did not expect her skin quality to improve to the degree that I said that I projected it would based upon using Renuvion. I showed her other facial rejuvenation patients that are in her age group, and I said Renuvion is going to make this kind of result improvement, and you'll see contraction of tissue, collagen fiber shrinkage, and a general tissue contraction that will make you look natural and very rejuvenated appearing. So as a person who's done these procedures, yes, we add lasers to the scars, we add scar creams, we add proper compression. Some of the pearls I have is compress your necks after Renuvion because I think we seal their lymphatics. I do use a 10 French drain now. I used to use a 10 JP, a very large drain. I think using a 10 French is adequate. I compress them for 10 fastidious days. Some patients I give a cervical collar to. This woman, because of her substantial laxity of neck skin, I wanted to make sure that she had good adherence of her neck. I use Tisseal as a fibrin glue. And these sort of results, I think, are a happy scenario to show off at 2 months follow-up. At 1 year follow-up, she hasn't gotten there yet, but at 1 year follow-up, they have very nice tissue turgor, and they have good fiber shrinkage that you can see in their skin that maintains itself, that over historical controls in my practice hasn't manifest. Now, this is a more complex technique because I'm using above the skin resurfacing at 20% and 4 liters, and I'm 60% under the skin, 2.5 liter flow rate, 6 passes, with neck, fat grafting, endo brow, lower bleph, canthopexy, and upper lid blepharoplasty, including resurfacing of her eyes. And here's a 62-year-old that I think you could be very happy with if you said, here's your start, and here's your 7 weeks post-op. That's a substantial improvement in the patient's overall appearance that will be very long-lasting. Some of her elements that we know are early post-op changes, like some of her tissue fibrosis, those are things she's not bothered by because she looks so rejuvenated. In her follow-up photographs, she looks so rejuvenated. Her neck skin has got from tissue coagulation, that sort of tone of her skin is going to improve substantially. We see the remodeling in the operating room with the 6 passes. As I do each sequential pass, I am literally seeing that skin behave the way I hope it will. And I'm also confident that I'm not going to have an end hit or a problem with the energy that's going to give me a full thickness injury. When I raise the skin flaps as part of the surgery, the skin flaps have excellent tone. There's no skin edge necrosis that's stimulated by the Renuvion energy. All the things that you and I as surgeons fear about the domain of those face and neck flaps are really not manifesting with the Renuvion patient as they manifest from point A to point B. Now, I've added another level of complexity because I've taken the external beam and used the plasma beam to also resurface her skin to achieve what you're seeing in front of your very eyes. A light pass at 20%. I go a little bit, I call it a half pass, and I go over the deeper lines around her lip edge, the deeper lines in her nasolabial folds, and the lines that you see on her neck that either we're addressing with microfat, which I did not do in this person, I've done in others, but by going over those lines and then redraping her neck skin, doing subcutaneous Renuvion, we're able to see tissue coagulation at the time of her treatment. And then you have the collagen contraction that you see and experience as you see the patient. They're pinch tests, and you may have seen this in some of the elements of publication that show how her tone has changed. And I do see that in patients. I can pinch that submental area that the woman says, can you just make this go away? And you can see that a couple months later, that still is holding up with excellent remodeling and collagen contraction and contraction of tissue, collagen fiber shrinkage. We know the physiologic basis of it. And this can be in a person who's younger. Here's a 48-year-old who's 3 weeks post-op. She had a neck lift alone with a course of platysmoplasty and a submental open neck with Renuvion. And look at that sharpness, look at the jawline, look at the skin that's contracted from the Renuvion 6 passes. And each of these passes, I'm very carefully assessing it. I'm giving it that thermal relaxation time. So I don't just go over the same area again and again. I pass along, as you saw in the initial video, and distribute that energy, give it a little dwell time, and then come back, do the other side, and then go back and forth and do 6 passes sequentially. I don't do one area and just color over that little area. If you think about a coloring book, I don't just put hard color onto the one area. I use 1 or 2 probe distance lengths between each pass, so I'm not stacking the energies. That's where I think the thermal distribution would be more excess. The patient has got good flexibility, even at a few weeks post-op. She has excellent coagulation of her tissue that occurred in the operating room. And then we get to see this sort of outcome that shows when I'm watching her video, watching her animate, she has natural movement. She has no seroma. I have not had a seroma increased risk in my practice. I am participating in a seroma study with compared to Vaser historicals and Vaser Renuvion. So we're seeing that there is some excellent benefits of Renuvion, but that's a side discussion that we can have as part of our panel discussion. But we look at a person that has a plethoric thick neck, and we look at an aquiline change that occurs. Perhaps you can attribute all of it to the course of platysmoplasty and the submental lipectomy, but I think you look in an objective way that the tissue contraction, the collagen contraction, and the overall remodeling that occurs, I would attribute that relative to my historical face and neck lifts, that in my mind, in my eye, in my photographs, I think it just attributes that kind of result that I don't think I was attaining in my previous years of doing this with other technologies. So I want to go over and just show patients that have had a host of procedures. I didn't want to go over time. I have a few minutes left. So I will have, from my standpoint, we look at the patients with a new eye that says lack skin in the left upper quadrant, lack skin in the left lower quadrant, and how the collagen contraction, tissue contraction, even in a person who's in their 70s in the right lower quadrant. I'm sorry, my face is literally over the image of the person there. So let's move that over. And you can see how things change from the right upper quadrant patient, weight loss, the catastrophic tissue changes, and then facial rejuvenation with Renuvion, etc. I'm Dr. Paul Vanek from Mentor Plastic Surgery. And if you have any questions, you can just give me a call directly, and I'm happy to answer any of your questions.